Go ahead.
Good morning, everybody. My name is Dr. Gideon Orbach. I'm practicing chiropractic here at the Weiner Wellness Center for a little over 13 years and a little under 19 years total. This is our virtual Wellness Week Summit. We have a fully stocked nutrition store that we're selling products at deep discounts all week long. You can call or fax in our orders. We'll get to that throughout the conversation here. Last week, I did a talk or a presentation about chiropractic, neurology, and rehab. And that lecture was, I like to call it more of a conversation than a lecture, was about what does your chiropractor do for you? How does it work? And what we're going to go over today is more going to be along the lines of what can your chiropractor teach you how to do for yourself. So we're going to talk about a few subconscious mind hacks and things that hopefully I can show you how to do today and get you fired up about that'll become part of the routine. So anyhow, what I'm really interested in is health. I define health to be the ability to recognize, interact with, adapt to, and overcome your environment, both internally and externally. So that means what's our internal environment is the neurochemistry within our body, our ability to digest our food, our ability to absorb our nutrients, our ability to have our brains talk to our all of our organ systems and all of our body parts and get them to function properly. Our external environment, that's you guys. I'm part of your external environment right now. You're part of mine. If you're able to drive through traffic without having road rage, you're doing really good with the external environment. So when we talk about health, there's a certain intersection between our physical health, our social health, our spiritual health, and even our financial health. And all of those roles, all of those roles and all those aspects of our biopsychosocial experience play a role into what our health is. So what I'm really interested in talking about and learning more about and teaching more about is how does our subconscious mind and our conscious mind work together in order to do better physical health. So far, so good? All right. So anyhow, when we talk about energy, when we talk about if you go to a ball game and your team gets men on base in the bottom of the ninth and the best hitter on the team is coming to bat, you can kind of feel a buzz in the stadium. If you're going to a concert to see a band that you really like or that you've been looking forward to and the opening act was really good, but they're tearing down their equipment and the band that you're coming to see is getting ready to set theirs up, you can feel that same buzz in the stadium. To a lesser extent, if you're interacting with somebody who you really like, or you don't even know why you really like them, but you just feel good in their company, that's all good energy. The opposite is true. We can have bad energy. We can have times and people and events that just complicate our body's ability to produce energy or to feel the bad energy. And what energy really is the strength and the vitality needed to have sustained physical and or mental activity. So energy creates vibration. So far, so good, Tracy?
All is well, Dr. O.
Okay. So we have this energy that we always want to look to increase the energy that we're putting out and that we're able to absorb good energy. And one of the ways that we do that is to be able to increase our vibration. Every cell of our body, every little organelle, every little body part that we have, even our big body parts, are in a constant state of vibration. And so much of natural health is being able to manipulate the vibrations that our bodies make. We can talk about chiropractic adjustments. When you introduce a force into the body, we get better movement. When I analyze and assess my patients and I make a diagnosis as to which area of their spine or which area of their ankle or foot or whatever body part I'm going to make an adjustment to, I'm looking for places that are still. I'm looking for the joints that aren't moving, and I'm introducing impulse and vibration into those areas in order to, if nothing else, increase their energy and their capacity to vibrate. So the next big concept that we want to talk about is stress. Our bodies don't necessarily recognize the difference between physical stress and emotional stress. What happens is, in times of stress, we have a nervous system shift and a chemical shift where we start to produce the hormone cortisol, the chemical cortisol more, and that leads us to our bodies moving towards a sympathetic state of nervous system. If we subdivide our nervous system into two different categories, we can talk about what's voluntary and what's non-voluntary. Our voluntary nervous system, if I ask you to wave goodbye, you understand the language. That's something you can do if you want. What if I ask you to dilate your pupils? Or what if I ask you to increase your heart rate or decrease your heart rate? Those aren't things that you can do just by thinking about or just by wanting to. We've got to take some sort of actual action to make that happen. So that's non-voluntary nervous system activity. And we're going to define that as autonomic. Our autonomic nervous system can be divided into two categories, our parasympathetic and our sympathetic. Our parasympathetic nervous system is a rest and digest experience, and our sympathetic nervous system is it winds us up. We're in a fight or flight mode. So what happens is in times of stress, our bodies go to a shift towards cortisol and a shift towards our stress component of our nervous system, where blood is diverted away from our digestive organs and it's pumped more towards our extremities in case we need to throw a strike or run away. So far, so good, Tracy? No questions?
Yep, all good.
Good. So anyhow, so we're in this stressful, wound up state. And what we want to do is we want to get out of it, and we want to increase our vibrations and increase our body's energy and increase our state of well-being. So there are a number of different ways that we can do that. And the first thing I want to talk about is meditation. Meditation is something that you can do to increase your own mindfulness and awareness and calm your brain down of noxious thoughts. You can use it to decrease unnecessary stress, and you can do it to gain control of your emotions and to give you better awareness, leading to decreased anxiety. And you can learn a useful new skill that can be done anywhere. So what we're going to do together is we're all going to have a brief meditation session. And what I would like everybody to do is to sit up as straight and tall as you can with your feet flat on the ground. And we're going to put our hands in our laps. And we're going to look just slightly up so that our eyes are looking at the point where the ceiling and the wall meet. And let's bring our tongues to the roofs of our mouths and just inhale through your nose and maintain the posture that you're in so you can feel your chest cavities expanding, filling up with air, with delicious oxygen. And your feet are just calmly, gently resting on the ground. And now I want you to breathe out. You're going to release your tongue off of the roof of your mouth and breathe out through your mouth. Let's do that again. We're going to bring our tongue up to the roof of our mouths. And this time, as we inhale, without lifting your feet up off the ground, I want you to inhale and feel less weight on your feet, almost as if you have little helium balloons attached to the top of your feet that are just starting to pull your feet as if they were going to break contact with the ground without actually moving. So let's go ahead and inhale, feeling your feet lifting without breaking contact with the ground. We're going to hold that deep breath for a second or two or three, and now blow out through your mouth. Let's do that again. Big deep breath in through your nose. Chest cavity is expanding, not lifting, but your feet are getting lighter and lighter, like they're being lifted off the ground, and blow out through your mouth. Now, I favor doing small, short sessions of meditation multiple times throughout the day. There are a lot of instances where I might finish up with a patient and have a few minutes before my next patient, and I might do just a few brief minutes of meditation that entail only a handful of deep breaths to calm myself down and to get myself ready for the next person who I'm going to work with. When you meditate for longer and longer periods of time, the chances are your mind is going to wander. You might start thinking about, what did I have for dinner last night? What am I going to have for dinner tonight? It's okay. Those are just thoughts, almost like if you were just sitting at the beach and you saw a boat or a ship off on the horizon and it sailed from your right to left or left to right. Eventually it just disappears and it's just part of the experience that has no bearing on you. What we're really trying to do with the meditation is just get our body to relax. So if we're relaxing, why are we beating ourselves up about thinking about other things at the time? We can just accept it and move right along with our meditation session. Are we good, Tracy?
Yep, doing well.
All right. So this is a nutrition week. We have probably about 30 presentations all week long, and most of them all deal with nutritional supplements and nutritional products and how they work and what might be appropriate for you and what might not be appropriate for you, and of course the why. But two things that I like to recommend. I mean, I want this presentation to be more about physical action that you can do for yourself, and I'm intentionally not going to go into big detail on the nutrition, but two things that I recommend to people when I talk to them about calming their minds, calming their brains, releasing stress and anxiety are fish oil with a heavy emphasis on the DHA, and ashwagandha, which is an herb that we carry here at the Weiner Wellness Center. So when I get the question, when I talk about meditation with patients and we do a few moments of practice and we do a little bit of work at this, always the question comes up, what should I take? What should I be taking for this? The answer is going to be fish oil and ashwagandha. Now, one of the things that I've become very interested in over the last couple of years is hypnosis. We're talking about how the brain works, how the subconscious mind unlocks and allows our conscious mind to have more control over a feeling of well-being and good health over the body. So I treat my patient population by and large are people who are in pain. So I like to study what other people are doing for pain management, and I like to know what's going on in the world and who's doing what and what can I learn from this one and maybe even what can I teach to that one and how can we collaborate and all become more effective practitioners. So I was reading this journal or this information packet that was put out by a hypnotist. And this was a story of a woman who had burning, searing pain in her feet. And she'd been to a number of different practitioners, including several medical doctors, a physical therapist, and chiropractors. And nobody was able to help her resolve her foot pain. On a completely different scale, she went to go see a hypnotist to worry about how she was going to be able to quit smoking. And through hypnosis, she was so successful with her smoking cessation protocol that she started sharing some of her stories with the hypnotist and talking to him about other issues going on in her life, including the burning foot pain. And the hypnotist suggested that, well, let's explore this in session. And she agreed because her first experience had been so good. And through hypnosis, she learned that in a previous lifetime, she'd been a witch burned at the stake. And the burning foot pain that she had was a residual from that experience of having been burned at the stake. When I first read that, I was more amused than impressed. But the hypnotist assigned her a number of different tasks and chores to do to right past wrongs. And what she had to do is she had to go to an animal shelter and volunteer with feeding and walking animals, and she had to feed people at a homeless shelter. And once she finished doing the tasks that the hypnotist had assigned for her, the burning pain in her foot went away. I read that journal article several times, and it began to make more and more sense to me, because we take the approach that pain, by definition, is an individual's subjective emotional response to stimulus. So if we have some sort of stimulus, we're going to experience pain like it was an emotion, and we're going to perceive it in a place in our body. That's why hypnosis and the meditation and exercise protocols like Tai Chi and yoga, which are so heavily focused on meditation and deep breathing and moving your body in specific ways that stimulate your brain, are so helpful to eliminate pain and to eliminate the kind of discomfort that goes along with it. So I have a hypnotist who practices in the South Hills that I occasionally refer patients to. He and I have collaborated and shared a number of patients over the last few years, and in places where his methodologies don't work, sometimes chiropractic does, and vice versa. So we're always looking to build networks and to include more people and to have a stronger team to help patients and to be able to offer people more benefit, even if it's just the recommendation of somebody who might know how else and where else to look. The next topic that I want to go over is called emotional freedom technique, EFT. Now, EFT is based on acupressure points. Acupuncture are thousands of years old. But the idea of being able to apply or to tap on parts of your own body in order to work on yourself is relatively new. This was developed by a therapist named Roger Callahan, who was working with Vietnam combat vets who in the 1970s, we really didn't have a diagnosis of PTSD. Post-traumatic stress disorder was just unknown at the time. I mean, the condition was very real, but it was undefined. So Dr. Callahan was working with this group of guys who were having a very difficult time re-entering society after the war, after their turn at the war. They were really very lethargic, people who had difficult times communicating, people who were socially distant. And this is a rehab center where they have access to a number of different therapeutic modalities and a number of different field trips and events and therapies that can be employed. And nothing is successful. There's no way of reaching this group of guys. They're just in isolation and having hard times. So anyhow, this Dr. Callahan is one of these guys who's just interested in so many different things and studies the world and is fascinated by whatever works. And he reads about this sequence of acupuncture points that people tap on themselves in order to have better emotional health. So Dr. Callahan says, why not? And we give this a try with his population of patients. So this is called, what we're going to do in a few moments is called EFT, Emotional Freedom Technique. And what I'd like everybody who's listening in and joining in this Zoom presentation, just worry about following along with me. And later today, in the comments section, I'm going to type out all the points that we're going to tap on. And so it begins like this. We have to acknowledge that there are problems, but we have to acknowledge that we're going to be okay. So when we look at what's going on in 2020, I think it's safe to say that most of us have more anxiety than we're used to dealing with. So we would have to begin our emotional freedom technique workshop or protocol by acknowledging a problem. For the sake of the drill, we're going to say that we're looking to calm our own anxiety levels down. And even though we're living in anxious times and some of us are dealing with it differently than others, and some people are handling anxiety better than others, we certainly don't lose track of the fact that we love and appreciate ourselves. Now, I'm going to make the mantra for what we are about to do as, even though I have this anxiety, I deeply love and accept myself. And in the past, when I've done this with groups, somebody made a very astute point that it sounded so egocentric, and they wanted their mantra to be, even though I have all this anxiety, I accept my role in God's plan. And I think that's fine. I think that those people really had an appreciation and an understanding of what it was that we were getting at. And they understood it so well that they were able to adapt what we were doing from an egocentric perspective to a perspective that suited their religious beliefs. So I don't say this and I don't lead this session with the intention of offending anybody or with the intention of alienating anybody's existing beliefs, so much as this is just how I like to do this protocol. It's what I'm used to doing. And I don't for a second want to pretend that there's only one right way. So if you want to substitute your own statements in, go right ahead. It's perfectly legitimate. So the first thing we're going to do is we're going to do all the tapping on the left side of our body with our right index and middle finger, just for the sake of being consistent with one another. And the place we're going to start is going to be on the knife edge of our left hand. If I were going to make a karate chop and break through a board, what part of my hands would I want to make contact with the hard board with? I certainly wouldn't want to do it with the delicate bones of my wrist in an open pack position. I'm going to use the fleshy aspect and the thicker bone along my pinky finger side. So what I'm going to do, my index and middle finger provide a pretty big surface area, and the contact point is fairly specific, but I'm going to, if not intentionally, at least accidentally get it right, because my point is small and my contact point is big. So I'm just going to start tapping right here on this particular spot. And then I'm going to say, I'm going to whisper to myself, I'd like this to be out loud, but it doesn't have to be so loud that the neighbors are going to hear it. Even though I have this additional anxiety, I deeply love and accept myself. Even though I have this additional anxiety, I deeply love and accept myself. Even though I have all this additional anxiety, I deeply love and accept myself. And I'm just tapping at this point fairly consistently at a certain rhythm and a certain rate. And I'm going to say my mantra one more time. Even though I am experiencing all this additional anxiety, I deeply love and accept myself. And there's no right or wrong answer as to how many times you should be tapping and how many times you should say the mantra. So much as I'm looking at the clock and I want to make sure that I get through the whole thing without interfering on somebody else's speaking time. And now what we're going to do is we're going to move to the top of our head. When you go to the doctor's office and they have you stand on the scale and they bring out that arm and you make yourself as tall as possible so you can squeeze out that last little bit of an inch and register a taller height, what's the tallest spot on your head? That's the spot that we're going to tap on our crown here. So once again, I'm using my right index and middle and I'm tapping on the top of my crown. And I'm going to say, even though I'm experiencing all this additional anxiety, I deeply love and accept myself. And you can see this is what I'm doing. Even though I have all this additional anxiety, I deeply love and accept myself. Even though I have all this additional anxiety, I deeply love and accept myself. Even though I have all this additional anxiety, I deeply love and accept myself. And now we're going to move to, if we trace out our eyebrow as it comes really as close as we can to the top of our nose, where our eyebrow ends before the nose begins, you probably feel like a very, very small indentation where two bones of your skull come together. And that's the point where we're going to tap. Even though I have all this additional anxiety, I deeply love and accept myself. Even though I have all this additional anxiety, I deeply love and accept myself. Even though I have all this additional anxiety, I deeply love and accept myself. Now we're going to go to the other end of the eyebrow where it ends. You find a little ridge of a bone that's the outside of your eye socket, and we're going to tap right there. Even though I have all this additional anxiety, I deeply love and accept myself. Even though I have all this additional anxiety, I deeply love and accept myself. Even though I have all this additional anxiety, I deeply love and accept myself. Now we're going to come around to about 6 o'clock with respect to the eye. And once again, we feel that ridge where the eye socket ends and the eyeball begins. This is the whole spot that's an opening. So we're going to tap right at the bottom of the eyeball, the top of the eye socket. Even though I have this additional anxiety, I deeply love and accept myself. Even though I have all this additional anxiety, I deeply love and accept myself. Even though I have all this additional anxiety, I deeply love and accept myself. Now let's move to the spot directly below the nose. That's sort of a seam in between your nostrils, right in the middle of the mustache. And we're going to tap on that spot. Even though I have all this additional anxiety, I deeply love and accept myself. Even though I have all this additional anxiety, I deeply love and accept myself. Even though I have all this additional anxiety, I deeply love and accept myself. Even though I have all this additional anxiety, I deeply love and accept myself. Then we're going to drop down just a little bit lower, above the chin, below the bottom lip. There's a crease in here, and we're going to do the same thing. Even though I have all this additional anxiety, I deeply love and accept myself. Even though I have all this additional anxiety, I deeply love and accept myself. Even though I have all this additional anxiety, I deeply love and accept myself. Even though I have all this additional anxiety, I deeply love and accept myself. Now we're going to come over to our collarbone. Our collarbone is the bone that the inside part of the front of our shoulder connects to our sternum, our breastbone at the top here. So we're going to find this spot where the collarbone ends and the sternum begins, and there's a space right in there, a very small, thin space. And that's where we're going to put our index in middle and tap right over that space. And even though I have all this additional anxiety, I deeply love and accept myself. Even though I have all this additional anxiety, I deeply love and accept myself. Even though I have all this additional anxiety, I deeply love and accept myself. One more time. Even though I have all this additional anxiety, I deeply love and accept myself. Now, from our collarbone, we're going to slide down to the bottom of our sternum, right where it ends. That's our breastbone. And then we're going to move out along that bottom ridge to the bottom rib to our side. And that's going to be the next spot we tap. Even though I have all this anxiety, I deeply love and accept myself. Even though I have all this anxiety, I deeply love and accept myself. Even though I have all this anxiety, I deeply love and accept myself. Even though I have all this anxiety, I deeply love and accept myself. Now we're going to move to the lateral aspect of our thumbnail. So if you look at your hand, your thumb, if we look at the nail, if we put our palms forward and the back of our hands are facing ourselves, if we think about the part of the thumb that would be closest to the index finger, we're going away from this. We're going to be on the part of the thumbnail that's the furthest away from the index finger, and we're going to tap on the outside of our thumb. Even though I have all of this additional anxiety, I deeply love and accept myself. Even though I have all this additional anxiety, I deeply love and accept myself. Even though I have all this additional anxiety, I deeply love and accept myself. Even though I have all this additional anxiety, I deeply love and accept myself. Now we're going to move to that same spot on the index finger the part of the pointer finger that's furthest away from our middle finger. So I'm tapping. I'm going to say, even though I have all this anxiety, I deeply love and accept myself. Even though I have all this anxiety, I deeply love and accept myself. Even though I have all this anxiety, I deeply love and accept myself. Even though I have all this anxiety, I deeply love and accept myself. And now we're going to move to that same spot on the middle finger, where we're going to be at the part of the middle finger that's closer to the index, further from the ring. Even though I have all this anxiety, I deeply love and accept myself. Even though I have all this anxiety, I deeply love and accept myself. Even though I have all this anxiety, I deeply love and accept myself. Even though I have all this anxiety, I deeply love and accept myself. Even though I have all this anxiety, I deeply love and accept myself. Now we're going to skip the ring finger, and we're going to move to the fifth finger, to the baby finger, and we're going to be on the point closer to the ring, further away from empty space. Even though I have all this anxiety, I deeply love and accept myself. Even though I have all this anxiety, I deeply love and accept myself. Even though I have all this anxiety, I deeply love and accept myself. Even though I have all this anxiety, I deeply love and accept myself. Now, what we're going to do is we are going to go to what's called the gamut point, which is in the fleshy musculature between the ring finger and the baby finger. So we are between the ring finger. I'm having trouble with this screen. I'm sorry, people. Baby finger, ring finger, fleshy musculature in between. So we're just going to tap here, and we're going to tap here without saying anything, but our eyes are open and we're just staring straight ahead. And we're going to keep tapping and staring for a few more seconds. And now we're going to shut our eyes and just continue tapping on that same spot, the gamut point between the fifth finger and the fourth finger, the ring finger and the pinky finger, and the fleshy muscular spot. And we're just tapping, tapping, tapping. And now we're going to open our eyes, but we're going to look down and to our right and continue tapping. And now we're going to go look down and to our left. Keep tapping and tap some more. And now we're going to roll our eyes clockwise as we continue to tap. I'm going to make a few circles in this direction with our eyes, tapping on the same point. And now we're going to go in the opposite direction, counterclockwise, continuing to tap on the same point. And I want you to continue tapping on the same point, and I want you to hum the alphabet. And continue tapping, and we're going to count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, and we're done. Okay. Tracy, any questions, comments, concerns, moral outrages from the crowd so far?
No, they're loving it. They love this technique, they said. So I think maybe just giving some more resources on where they could find more information and charts for the tapping points would be good.
That's exactly what I'm going to do this afternoon at lunchtime. I'm going to in the comment section in this lecture, I'm going to post a comment where I'm going to leave one, a listing of all the places that we've tapped, and two, I'll put a link to 2 of the websites that I particularly like for more information. Is that okay?
Yes, that would be perfect. Thank you.
Okay, excellent. So let's do this. Before we move on, I'd like to do a little bit more meditation with the group. Well, first of all, before we even do that, I'm just curious from the people who want to offer some feedback. Do you feel an energetic shift after doing this this EFT session, does anybody feel a little bit calmer? Do you feel like you're breathing deeper? Do you feel relaxed? Do you feel any of your senses might be a little bit more acute? Do you feel like your posture might be a little bit better? Has anybody noticed any kind of a subtle change or a subtle shift that they feel like reporting on our Facebook feedback forum?
I'll watch for the comments. Our Facebook
Okay.
feed is a little bit delayed. So
Okay.
when you say it, it'll take a
Uh-huh.
few minutes to get on here, and then I'll
Okay.
give you the feedback.
All right, sounds good. So anyhow, I do this, I mean, once upon a time, in a pre-COVID time, we would do this live. And people would say just that some people said that they felt more relaxed, that they felt lighter, that they felt like they were able to sit up further and straighter. They just felt a little bit more comfortable in their body. So I had a good laugh with Joe and Tracy earlier this morning in our opening dialogue, where Joe mentioned that he started using a foam roller to stretch himself, to work on his own back, and to do a few different types of exercises every day. And then he started, as a result, he's feeling better, and he's starting to see me for adjustments less frequently. So we had a good laugh about why am I teaching you how to do things that limit your need to see a chiropractor rather than increase your need to see the chiropractor. And that's really what we've been about at the Weiner Wellness Center. As I mentioned at the beginning, I've been here for a little over 13 years at this point. And what we want to do is we want to treat our patients and our clientele as like family, that you guys are an extension of one of our very important social circles. And we're not eager to see people who are in pain 3, even 4 times a week. We're not eager to teach our patients how to become dependent on their chiropractor. We're eager to teach you strategies to be able to help yourself and to realize that taking nutritional supplements, getting periodic chiropractic adjustments, getting periodic muscle therapy, in times when you feel like I feel okay and I want to feel good, that's the time to come and see us. And we want to teach you strategies and exercises and movements and things that you can do for yourself that help you feel okay quicker and help you feel okay for longer periods of time, and make the jump from feeling okay to feeling pretty good to be really a relatively easy jump to make. We're not looking to create dependency amongst our patients. We're not looking to commandeer people and to have your entire schedule be focused around how many times a week did I see my chiropractor. So I think that's a pretty big concept shift in terms of how clinics are run, how people practice, what we're looking to achieve with our patients, what we're really trying to have happen here. So I'm very anxious, whether it's in the next few minutes or whether it's when I get a chance to recheck this forum at lunchtime, to get people's feedback as to how they felt after doing the EFT session. And what I'd like to do before we go on also is do another little brief meditation session with you guys. So let's do this. Once again, feet are flat on the floor. Hands are going to be in our laps. We're going to be sitting up straight and tall. And we're going to maintain this very posture the whole way through. So when we breathe in, we're going to feel our chest cavities expand this way and not elevate our shoulders up here. So we're sitting comfortably. We have our hands in our laps. We're going to put our tongues on the roof of our mouths. Our eyes are looking at the place where the ceiling and the wall meet. So we're looking up without really extending our heads and necks too far backwards. And what you're going to do is you're going to inhale through your nose, feeling your chest cavity expand and feeling your feet like helium balloons have been attached, and they're just ever so slightly lifting up off the floor without breaking contact with the floor. And we're going to hold that. We're going to hold that delicious oxygen in our lungs for a few split seconds. And you're going to release your tongue off the roof of your mouth. Exhale through your mouth. And maintain your posture, and let's inhale again. And all we're focused on is inhaling delicious oxygen and feeling our feet get light as they never break contact with the floor, but you might feel them lifting just a little bit. You're going to hold and hold and hold for a few more seconds and blow out through your mouths. One more time. Tongue on the roof of the mouth. And we're inhaling. And we're holding our delicious oxygen in, and our feet get light. And any thought that you might have in your mind besides your feet getting light is okay. It's just going to vanish off into thin air when you're ready for it to vanish. And let's release the air and blow out through our mouths. Okay, so we talked mainly about meditation, and in all my previous lectures and workshops, we've always talked about deep breathing. And now what we're doing is we're just taking that deep breathing to one more level of being profound and talking about what other body parts should be doing as you're breathing deeply. And what we're doing here is we're bringing more and more oxygen into our bodies. What that oxygen does is it helps to feed the cerebellum. The cerebellum is the part of the brain that does two things. It coordinates movement. So if you were going to march in place with your arms and legs pumping, right arm, left leg, switch, left arm, right leg, that's cerebellar activity. That's coordinated movement. The other thing that the cerebellum does is it inhibits the sympathetic nervous system. So we talked about the sympathetic nervous system in the context of times of stress, where blood is diverted to the extremities, our heart rate goes up, our blood pressure goes up, we're starting to wind ourselves tight, we're gasping for air, we're in survival mode. We don't want to be there. If there's a time of attack, we have to be there. But when we're sitting there at our desk, or when we're just watching TV, or we're reading a book, we don't want to be there. We want to be in a parasympathetic nervous state where the blood is in the digestive tract. We're in a rest and digest, wine and dine nervous system mode. And when we talk about cortisol and the stress hormone and our subconscious mind and our conscious mind not talking together in a calm, relaxing way, but rather winding ourselves tighter, creating, letting the anxiety feed itself and becoming even more anxious yet, that's all sympathetic nervous system activity. So getting deep breathing exercises, and as we subtly make the shift from being deep breathers to actually meditating, we're starting to relax the cerebellum and give it the tools that it needs and the nutrient that it needs to basically do its job, or its jobs: better coordinated movement, more comfort in our body, less anxiety. We very, very briefly touched upon using fish oil and ashwagandha as nutrients to help diminish our stress level and help us get out of that cortisol output and become more relaxed. We spent some good time going over the EFT protocol and how do we do physical modality, the act of tapping, of introducing vibration. How are we going to put that vibration into our own body to change our energy, our ability, and our capacity to have vitality and to do work and to create movement? How are we going to do that in a way that's relaxing, that's not causing more stress, that's rather starting to unlock our subconscious mind and get better integration with our conscious mind? Empowerment, things that we can do for ourselves. These are the major concepts of today's conversation, of today's workshop, things that I'm really personally very interested in. One of the things we covered is when we talk about health, health isn't just physical. It's not just nutrition that we do at the Weiner Wellness Center. There has to be a component of our spiritual integration, even our financial integration. We have a number of people in our group Rolodex who practice different aspects of healthcare that we don't necessarily do here at our center. that we share patients around. So sometimes people come in with conditions and with problems and with symptoms that were just not in our strong suit. These are just simply not problems that our team, our very capable team, is in our strong suit. So we have a group of people that we refer to when we recognize what's going on with people. We are a very good comprehensive wellness center who offer a lot of modalities. A lot of different people have their own clinical strengths. Myself, I do hands-on neuromusculoskeletal brain repair chiropractic. Dr. Honigman does lifestyle chiropractic and nutritional consultation. Jeffrey Nisnik does allergy elimination, organ health. Adam Karwa does muscle therapy. Dan McPherson comes in occasionally. He's on a lesser schedule with us. He's not full-time at our clinic to do nutrition. He does a little bit of allergy identification. He does nutritional supplements in turn with the Assyria device to measure the vibration and frequencies of the body to determine what might be missing, where the nutrient deficiencies may lie. So we're really able to help a lot of different people with a lot of different conditions and a lot of different symptomatologies, but we can't do everything. And we do have hypnotists that we refer to. We have financial planners that we refer to. We have a naturopath that we refer to. We have a homeopath that we refer to. And I think that we have the respect, the mutual respect of all of those people because they send us patients too. So as I said, I'm going to, at my lunch break in the middle of the afternoon, I'm going to post in the comment section more details about the EFT. As I said, I'd like that people followed along with me and weren't too busy taking notes because they'll all be provided. Are there any questions, comments, moral outrages, which I hope not, or are we good to?
No moral outrages. You're safe. There are some questions.
Okay.
So many people said they have a sense of peace after tapping, felt a
Very
little bit
good.
lighter.
Very good.
One of the questions was, do you tap 4 to 5 times each place or how often?
Excellent question. I was looking at my watch in the upper right-hand corner of my computer thinking like, how can we get through all of this and make sure that there's time to answer questions? And so I abbreviated everything that we did. You can tap 4 or 5 times. You can tap 40 or 50 times. It just simply depends on how much time you allot to, like, am I going to sit down and am I going to spend the next hour doing EFT before I go to bed tonight? Am I going to wake up 10 minutes early so I can do my EFT before I start my day? Am I going to run through the whole cycle and tap everything once before my next patient? All are perfectly legitimate answers. There's no black and white. But I just want to remind you that when Dr. Callahan got started with this, he was working with people who had very severe post-traumatic stress disorders. So they started off doing, oh, well, let's try this. Let's try it again. Tuesday will be a good day. Let's try it again. And the benefits were just rolling in and the results started speaking for themselves. So this became something that people literally, I mean, they spent hours doing tapping as these guys were able to regain their social function and reintegrate into society. And I mean, I have a hard time using the word cure. I don't know if a cure really exists for anything, but they said that they cured themselves of their some of them said they cured themselves of their PTSD. So if you really like what we did today and you come back and revisit my comments later and you will rewatch the workshop and you integrate this as part of your day and you feel like you're one of those people who can spend 5 minutes doing an EFT protocol, tapping once or twice at each spot and do that every other day and get benefit, you're a winner. And you know what? If you're one of those people who's really immersed in this and said, every single night, without exception, I'm staying up. Half an hour before I go to bed, I'm getting started, and I'm staying up half an hour later because I want to have a full hour of tapping every day. You're a winner too. So the real answer is what works for you is the right is right. And this was very much abridged. I mean, we didn't skip anything, but we shortchanged a few places just because I wanted to get through it all.
Yeah. Yeah, you just have to make it fit in your life. I
Right.
mean, most people fail programs not because they didn't try, but because the program was too much. So,
Yeah.
fit it where you can, how you can do it, and anything is beneficial. Last question. I have tremors. Any suggestions for doing tapping for tremors?
Even though I'm experiencing these tremors, I deeply love and accept myself.
Good
Even
suggestion.
though, even though I lost my job, I deeply love and accept myself.
Hmm.
Even though I struck out 3 times with the bases loaded, I deeply love and accept myself.
They
Even
use
though I
that for
missed
our
those foul
kids.
shots in a one-shot, 1-point game with no time left on the clock, I
Right.
deeply love it. Right? It's really the beauty of it is that it's so applicable to so many different people's individual, unique circumstances.
Yeah, it's a great technique. Well, thank you so much, and
Thank
thank you
you.
everybody for the questions. Go back, check out the feed, and maybe there's be more questions that you can
For
answer. And
sure, for sure.
you're going to post those links.
And,
So,
and before I sign off and start seeing patients, Tracy, I just want to thank you for the way you've moderated everything and kept all these workshops going and operated the controls in the tower. And everybody, so far, everybody's landed on their time in the runway. We haven't had any above ground or on the ground collisions. Keep up the good work. Thanks for all of
oh, well,
your
thank
hard
you.
work.
I appreciate that. It's my pleasure. All right, guys, Jeff's up next. Stay tuned. See you, doctor.
Okay, you know it.